I'll record this part of the lecture. Um, I will not be recording what we do in the lab. So in microscopic analysis, remember the first two types of analysis are physical and chemical. And we did the chemical last time. Today we'll do a quick physical look. We did sort of. Physical, there are some gross things about, and I don't mean gross as in ugly or awful, but looking in the big picture, there are some gross things we can tell from a physical exam. If color variation is a result of how hydrated you are, what you've eaten most recently or consumed most recently, what drugs you might be taking, lots of different things. But certain colors are indicative of problems. Pink or red indicates blood in the urine. That can be a problem. Cloudy urine could easily be a symptom of a UTI as well. A bad odor could be a symptom of a UTI. A sweet odor could be a symptom of potentially diabetes. Again, regular urine is sort of straw colored and doesn't have much of an odor and is clear. Okay. So we look at those. Those are just things to look at and describe. When you're actually doing a urinalysis, you're going to look at these things and you'll note them in the records, in the chart of the patient. Then we do the chemical analysis, which we did last week, and again, you note all those results in the record. And on the break, I'll go back and get you a nice large chart of those test results that you get from the chemical strips. Same with a pregnancy test or any other test that we do. There are about 100 tests that can be done on urine. Many of them are not readily doable in a physician's office. Simple. And one of them that isn't really readily doable because they're not usually set up for it is a culture test to see if you're growing any bacteria. Again, in a healthy person, urine should be sterile. So the third major one is the microscopic exam, where we're looking at cells in the sample. Those cells can be red blood cells, white blood cells, or they can be epithelial cells. Okay, casts, crystals, microbes. Now, we can, under a microscope, see most bacteria, and because bacteria, and we can readily see blood cells, because bacteria are about 1/10 the size of most blood cells. If we can see the bacteria, we can see the blood cells. Pardon? Mm-hmm. So we will do that. We will be using what they call the high power objective, which is by the time we get done, there's the main objective on the microscope, which is where what the main lens is. In this case, it magnifies the image by a power of 40. And then we have a further 10 power magnifier in the eyepiece. So for a total of 400. So we can see a pretty small image. There is a higher magnification on the microscopes, but that's an oil lens, because the higher the magnification, the dimmer the image is, and the oil makes the image a lot clearer. We will not be using that in this class. We use it in microbiology because some things are best visualized that way. And quite frankly, some structures are too big to use that much power. An optical pardon?
It's kind of like having the binoculars, and like I'm using binoculars to see you.
Right.
And it would be like
getting a great new view of my nose. Right. Yeah.
I'm not seeing you.
Yeah.
Or anything really about you. Just
Just a little small piece.
Right. So that's
And,
not helpful.
and so what we do is we look in there, and as we are looking at things like cells and crystals, what we do is we estimate the number of these things that we can see in our field of view. It's called HPF, high power field. We just count the number of cells. Some number of cells is normal in a urine sample,
Right.
because it's part of the filtration mechanism. Larger numbers, and that usually is in the range of about 5 cells in a view, in the little circular view that you could see through the microscope. You don't go probing around and counting them throughout the whole image. We're looking at just that static field. So we do that. Crystals come in various shapes, some of them very, very regular, and when they're regular, they are so obvious. That they're just really easy to see. Crystals don't necessarily mean anything, because even healthy people will have crystals. The other day, Monday, when I was just testing the microscope and doing a quick round of microscopic analysis on a urine sample, there wasn't a whole lot of solid material in my urine. Very little, in fact. But there is almost always some, because we do excrete these things, they concentrate, and crystals form when they get concentrated. So we'll see what some of these things are. So we'll go on.
Have you ever tried to do urine analysis or microscopic urine analysis after you've eaten a lot of
After I've what?
eaten a lot of cake
No,
or acid or something like that?
no,
But when that would make like more crystals than normal.
not likely. Crystals usually are minerals, calcium and ammonium phosphates, and oxalates, the things that can, if you have enough of them in there, form kidney stones. But things like cake and sugar shouldn't do that. Now, so they're also dependent on the pH of the urine. So you never do you will do your microscopic analysis, but you don't ever do these things in isolation. You always do a chemical analysis on the urine as well, because the formation of crystals is often dependent on pH. What happens is, in many cases, you won't actually do a microscopic analysis if you're working in a clinic, unless you see evidence of infection or blood or something that's different on the chemical testing. Okay, because it takes time. You have to prepare the samples, and then all the equipment not the microscope, of course, but you have to clean the microscope, and then you have to throw away all the equipment that you used to do the analysis. So it's time consuming, simple as that. But if necessary, you can do that. So what we're doing here, what we're looking at when we are looking at cells, is red blood cells, white blood cells, and epithelial cells from the bladder, from the urinary system structures. Okay, epithelial cells. We'll get to all of these things in a minute. Let's go down. Red cells. Well, they're round. They're biconcave. Remember, a red cell looks like a donut with the hole partially filled. They look clear and pale on the microscope, largely because once they, unless there's a lot of them, there isn't enough hemoglobin there, and the light and so forth will shine through. They are what we call enucleated cells. They do not have a nucleus, so there's no dark spot in the middle. That's one way you can distinguish them from certain kinds of bacteria. You can see that dark spot, which is the nucleus in those bacteria. They are about half the size of white cells. And usually in a urine sample, if you're looking under the microscope, you're going to see less than three or less in that high power field. So 0 is common, and it's not at all unusual to see a few. When we start getting more, and this is where the RBCs show up on the chemical analysis, usually as numbers. So this is, again, something to look at from the chemical analysis. If the chemical analysis says there are red blood cells, you should be able to see them, because there ought to be enough, the way we prepared the slides. So here's what they look like. You can sort of see that black dot in the middle is not a nucleus. Note that it's right in the exact center of those cells. That's your first clue that it's not a nucleus. Nuclei aren't in the center of cells. They're usually offset. So they're what we call biconcave, meaning they're indented on both sides of this donut shape. Okay, and on the right in that image is what they look like. Now, this is, if this is a high power field, there's looks to be about 30 of those things in there. That's not good. Okay, and in the other one, that's a really contaminated field. So this is a person that has blood in their urine. Okay, why do they have blood? Well, obviously, menstruation, if that's when you take the sample. It's probably not a good idea to try to take a urine sample when the woman is menstruating. So that's pretty clear. UTI, stones can cause physical damage and thereby shedding a little bit of blood. Trauma, tumors, and some medications that we have. Anytime you see these things, with the exception of a patient who's menstruating, you find out later, oh, well, I'm menstruating. Thank you very much for that information. We should have had it first. Beforehand. Yep, should have had that already. But then you have to retest. But any of these others, when you see red cells showing up, there needs to be some further testing. And questioning.
Before you give my
it's probably a good idea, because it's a waste of their time and yours. Plus, they're going to be wearing some protective gear that they have to remove, and that's, that's not fun for them either.
Right.
So we've got other things. So if you see such a result, and they've already said that they're not menstruating, you might ask if they've what other symptoms they have, or have they have they fallen? Have they had some sort of traumatic event with their kidney? So the white cells, these are our leukocytes. You might see a nucleus, not necessarily. It just depends on how the cell is prepared. Sometimes it's very hard. So usually we have a few, 5 or less, in that high power field. So you won't see a whole lot of them. Usually they're indicative of a UTI. It's a response. The infectious agent is there. The immune system is mobilized. That's a white blood cell system. Bingo. And then they get cleared out. It might be an infection. One of the things, if it is an infection of the reproductive system, male or female, then using the clean catch strategy usually takes care of that. But sometimes people don't have the other symptoms we might expect from a UTI. Other causes, inflammation. It really, there are some other kinds of causes here. But again, you see these things, and that warrants further look. Yeah, a lot of people don't have it. Pretty much Yeah.
Friday just be a lot.
Yeah. Well, a lot of people are pretty passive about these things. Okay, so we have here we have a picture with both white cells and red cells. Note on the image on the left, we've got that A points to a white cell. Look how much bigger it is than the red cell. Quite a bit. Pretty obvious. And the red cell, again, has that biconcave look. And in urine, these things often clump together, group together. So you see here on that image on the left, we see these things have paired up. So this is kind of probably fewer white cells. But in the one on the left, they've clumped. So they're forming those. So those are there. So epithelial cells, we've got three types: squamous, transitional, and renal. And the source of the squamous cells is the lower urinary tract. And they are described here: large, flat, irregular shape. Should have a pretty visible nucleus, but maybe not. And this is not unusual. We shed cells all the time. All of our cells are shed all the time. So we're not terribly worried about the squamous cells. And here's an example. Note that they're irregularly shaped, and most of them have a dark spot, obvious nucleus in there. Okay, the transitional cells are found in the upper urethra and in the renal pelvis area. They could be round or oval. They might appear to have a tail. Don't mistake them for sperm, right? They may have a couple of nuclei. Cells are not necessarily mononuclear, so they may be. And again, a few of these critters are normal, but large numbers can indicate renal damage. So this is sort of what a transitional cell looks like. We've got the A in this is a squamous cell, and the B is a transitional cell. It's a little more regular and just a smidgen smaller than a lot of the squamous cells. Renal epithelial cells can be round or oval, large nucleus, and again, some of these in a sample can be are normal, and getting several, whatever that means probably between 5 and 10 or more in the sample can give us can indicate tubular damage. So we also may see these long structures of tubular tissue when we see these renal tubular cells in a sample. So you don't necessarily see the tubular part. Okay, so those are the kinds of cells we look at. Casts are a cylindrical shape, and basically they're little containers. They might have other things in them, like cells or crystals. Casts, we hope we don't see, because usually we're concerned about breakdown of the proteins in the tubules, and could indicate kidney disease. Again, could indicate kidney disease because nothing is set in stone. So, but what it does say is, got to check it out. We need more tests. As I said, we can do 100 tests on the kidney, on a urine sample. So we have things called hyaline casts. They're empty. They may or may not be normal. They're seen commonly, but they're hard to see. So don't be worried if you don't see anything. In fact, I hope you see almost none of this stuff. in your sample. You may see this when people have low flow of urine or when they're heavy exercisers. So this is, you can see why this is hard to see. A Hyalin cast, this is sort of an outline. And this is done with low light. We can control the level of light that comes up through our sample. So you want to, when you're doing a microscopic UA, you want to dial the light down and dial it back up to where you can start seeing things, and keep a very careful eye on your sample, because they can go from visible to invisible faster than we can register it sometimes. But we're looking for these things. It sort of looks like a shadow here. Granular casts have things in them, granules, pieces of stuff. They could be crystals. They could be parts of cellular debris. And they might indicate renal disease. And again, there's some disagreement as to whether their presence indicates anything until there's a lot of them. And in the case of all of these, there's disagreement as to how much is a few and how much is enough to cause a problem. So it depends on the urologist. But we want to, again, if we see these things, we want to check them out. And so we can see this granular cast is much, much more visible than the one that we looked at a couple of minutes ago, the Hyalin cast. So this thing obviously has things in it. So that's one thing we're looking for. We can have red blood cell casts, which are going to be hyalins with red blood cells in them. This is something to be worried about because it indicates bleeding within the kidney, or some other causes. It's one of the tests we use for looking for lupus, for instance. Lupus nephritis, the nephron, it gets inflamed, and we start getting these things, and in trauma and renal failure, obviously. But here's what it looks like. You can see that those things in there are bigger than the granules that were in the granular cast, and they look a little like the red blood cells. Pardon? Yeah, they're the kind of donut shape of the red blood cell. Okay. We can also have white blood cells in them, and again, that's not normal. And there are several different other things that can, some of them the same as red casts, and some of them different. Pyelonephritis, inflammation of the nephrons. We have lupus again. Lupus nephritis is the damage that's there is from clogging those nephrons with large complexes of DNA that have agglomerated and can't be cleared. That's what causes the lupus nephritis. It's also very painful, I'm told. So the white blood cell casts are big cells, big chunks of things that are obviously not red blood cells. So again, these are not a good thing. Epithelial cells can also be there. They're rare, and they have their own causes. Remember, the epithelial cells are being shed by the lining of these organs, and when there's a lot of them, they get sort of picked up in these casts. Again, they're fairly rare. Then we have waxy casts. They are a bit wider, square on the end, yellow color. That's the fat that's in there, the wax, and they may indicate a really advanced renal disease issue. Again, these are not something we want to see ever. So here's an idea of a waxy cast, and what they look like. Again, you can look at that. The one on the left there has what looks like cracks in it. So it has that sort of look to it. Crystals. Crystals form when the concentration of the compounds that make the crystal gets high enough that they can't stay in solution. A lot of times crystals can form actually in your sample, especially if you've set it aside and refrigerated it, if there's a high concentration of these salts. So we've got oxalates and carbonates and phosphates of calcium. And some of them can be made up of medicines that are being cleared that are not very soluble themselves, and other conditions that people can have. So we get a high concentration of these things. It depends on how soluble they are. You're not going to see crystals of sodium chloride, for instance. Sodium chloride is way too soluble. It also depends on diet and what drugs you're taking. One of the things we look at in drug development, are there indications of kidney damage that can be caused by the drug literally precipitating in the nephrons and causing more damage than the disease being treated. Temperatures, okay? Some crystals form in cooler urine rather than room temperature. As if things begin to evaporate, we might find that, again, we concentrate the salts. But one way to prevent that is to keep the lid on it, right? And another one is if the pH is different. Some crystals will form more in acid pH and some more in alkaline. You have a question, Maddie?
So when I'm doing we bring it up, set it up to get to room temperature and stuff, would you like switch the sample around before actually using it?
Well, I would.
Okay, so that would make sense to me.
Yeah, I would.
Like
I would sort of,
there.
but not shake it, just sort of swirl it a bit to encourage things to dissolve. Yeah, it would rise things to the bottom. Now, one of the things we do when we are doing a microscopic urine sample is we'll take a part of that sample and put it into a centrifuge tube and spin it down so that we concentrate all the solids at the bottom. The other day when I was looking at my own urine, I got my sample, I looked at it, looked clear as a bell. I centrifuged it, and there was just this little bitty hazy thing in the very bottom. The tube itself comes down to kind of a dull point, a blunt point. There's a little hazy layer at the very bottom. You pour off most of that liquid and then shake, swirl that and shake it up. And then it was much more visible that there was something there. Okay, so what we do is we just look at then we look at the crystals that we see under the microscope, and we'll look at, what some of those look like, and just make an estimate. You're making a very qualitative estimate, few, some, or a lot in our field. And the other day when I was doing this to myself, I mean, I saw 4 or 5 in the field total. Okay, some of them depends on the mineral. Calcium oxalate crystals, oxalates are not terribly soluble, so it's not unusual to see oxalate crystals. But they sort of look like a square with a cross in the middle, and that's because in reality they're octahedral. They're a double square pyramid. So if you look at it, it looks like you're looking at the edges of this, and it looks like a cross, literally, like that. So that is almost always, and that's where it is right there, that's almost always calcium oxalate. Most minerals have very distinctive crystal shapes. Okay, we got triple phosphate. We have, which is a different thing, a magnesium, ammonium, and phosphate are in there. And again, we're looking at something that happens when bacteria are present in alkaline urine. They could be a source of stones. They're actually kind of normal. But if you take a look at these things, they sort of look like long triangular prisms. Okay. Urate crystals, which are from uric acid. Uric acid is something that we see in things like gout. They form in the urine. When they form in the joints, they're extremely painful. It's like putting sand in your joint. And they can look like a variety of different shapes. We might see those, but we're more likely to see them in people with kidney stones. But they can be a variety. Let's take a look at some of those. And the color may be visible or not, a little bit amber, but there might be anything else in there. But you can see we've got in the upper right, they've got those rosette structures. In the upper left, we have the rhomboid type structures, and we have other kind of oblong-y things in that bottom picture. We have actually several different structures in the bottom picture. So they can be kind of what we call polymorphic. They can have a lot of different shapes. We have amorphous crystals. Amorphous crystals mean that they don't really have a regular shape that we're used to. And this can be various different things. They can be uric acid, they can be phosphates, and we need to be careful that they're not bacteria. And again, if we can't distinguish them, we just say, I might be seeing bacteria, and it might be that you're going to want to culture. Okay. Gentle heat can dissolve these things. They generally tend to be there. They're not terribly abnormal, but they can look a little like cloudy urine. And we just have to look. We have to measure the urine pH. But amorphous crystals look like that. It's just like, and if you remember from your microbiology class, you can see why you might look at this and think, oh, this might be bacteria. Okay, because the reason is that these things do not have a regular shape. Okay, in bacteria, we look for rods or cocci. Most of the bacteria we're going to see in urine are going to be bacilli. They're going to be the rods. So on the upper left, we see rods and what looks to be a white blood cell. Okay. We expect to see that white blood cell if we've got bacteria in the urine because it's an infection. Okay. On the other slide, it looks like it could be cocci. Looks like there's some diplococci there. And in the bottom slide, again, we see rods. I remember the rods can be like the one in the upper left. Those rods are kind of thick. And the lower, in the lower slide, the rods look a little thinner. Rods can be anything from looking like a pencil lead to looking like a Vienna sausage. Okay. So when we see these things, we want them to be examined for bacterial infection. Okay, so that's that for that slide. Questions? So that's what we're going to look for. So when we go in, we're going to take a break now. We'll go to the lab and I'll give you guys a urine cup, and you can either take it on break with you or put it down and come back and get it when you're done with your break. Go ahead and get a urine sample. And then we'll go through the processing of that sample in the lab when we come back from break. Okay. All right. So if anyone's watching this that's not here, please send me an email with the word Cardiff, Cardiff, in it. Thank you.